I've been to the Martin Center in downtown.
Okay, that's right. But Dr. Santana is board certified in nephrology and hypertension. She completed her med school at, you have to help me out, Afro-American?
Yes.
In her hometown of the Dominican Republic. She trained at Henry Ford Hospital in Detroit, Michigan, and where she served as a chief fellow. So Dr. Santana is fluent in Spanish, and her clinic is located in Franklin. She's available to see patients who are admitted to Williamson Medical Center. So Dr. Santana, I will turn it over to you.
Thank you.
Thanks for letting me have the floor.
Oh, no, are you kidding? Anytime. Thank you for having me. Thank you guys for coming. Like Katie Beth said, I'm a nephrologist, and I usually start off telling people what a nephrologist does, because a lot of people have a misconception of between a urologist and a nephrologist. And so I usually start off kind of explaining my background, and that kind of helps people make sense of why I'm here speaking to you about kidney disease. So urologists are a little different than nephrologists. Urologists are surgically trained, but they also do take care of the kidneys too. Nephrologists are a little different in the sense that we don't operate on kidneys, we don't take them out, we don't cut them in half, we don't take out stones. We kind of prevent any damage to the kidneys after the surgery or before the surgery that the urologist is going to perform. And so another part of what I do is hypertension or high blood pressure, because a lot of people think that the blood pressure in our bodies is controlled by the heart, but it's actually the kidneys that control our salt and water intake, not intake but excretion of whatever we take in, and that is really what blood pressure is too much salt and water in our bodies. So it kind of goes hand in hand, the kidneys with high blood pressure. So today I'm going to talk about kidney health, and we're going to start off by talking about what are the two main diseases or conditions that damage our kidneys. And in the United States, the two most common reasons to have kidney disease are diabetes is the first one, and the second is high blood pressure. So we're going to talk about both of those a little bit so you'll understand how they affect the kidneys. And I usually try to give a bit of a refresher for people who don't have diabetes or don't have high blood pressure, so they understand what those conditions are and what it means to your kidneys if you have any of the two conditions. So to start off, we're going to do high blood pressure first. And high blood pressure or hypertension, which is a medical term for it, is basically going to put anybody who has that condition at a higher risk for heart attacks or strokes if it's a condition that continues for more than just a couple of weeks. If it's a long-term condition, after a long time of having high blood pressure, people have a high risk of heart attacks and strokes just because of the pressure being high in their body. So really, everybody usually gets worried about something going on in their body when they have symptoms. But high blood pressure is one of those conditions that's very silent, that you don't have a symptom until it's too late or the blood pressure's become too high. So it's not something that you're going to have chest pain with, like a heart attack, or like you won't be able to move your hand or talk when you have a stroke. So it's something very silent. And so there isn't anything that you could be expecting to show up in your body before you know that you have high blood pressure. And the way we find that people have high blood pressure is when they get their blood pressure checked. And you'll always, yes, oh, I thought it was a question.
No.
So you'll always hear two numbers given to you when they tell you your blood pressure is so-and-so. They'll say something over something. And I'll explain what that means. Basically, those two numbers are two different kinds of blood pressures in our body. The top number is what we call systolic blood pressure, which is the pressure that our body has when the heart beats and it contracts. That first gush of blood that comes out of your heart when it pumps and it squeezes all that blood inside and out, that pressure at that moment is called the systolic blood pressure, and that's the top number they give you when they tell you your blood pressure is this. Now the bottom blood pressure is called the diastolic. The diastolic is a pressure once the heart relaxes and after the beat. So the heart beats and squeezes all the blood out, and then it relaxes to let more blood in. So it repeats the cycle again where it squeezes, pushes all the blood out, and then it relaxes to let all the blood in. So that bottom pressure when they say, for example, your blood pressure is 120, that would be your systolic, over 80, the 80 would be the diastolic. And so those are the two names that that you will see that people talk about when they talk about high blood pressure. Because some people's blood pressure on the top is fine, but the bottom is high. But most commonly, the top number's high in the older we get compared to the bottom number. Usually a lot of people don't have problems with their bottom number, it's the top number. And so we'll talk about that in a little bit. So I have this chart here that says what is labeled as normal blood pressure and what is labeled as high blood pressure. And then anything in the middle between not really normal but not really high falls into this category of pre-high blood pressure or pre-hypertension. And so a committee of doctors that dedicate their lives to research, they don't really see patients. They just go into rooms and have committees and look at information from studies. They come up with these guidelines for the rest of us who do see patients. And so this new guideline came out recently, and they've changed kind of what we used to call in the past that we thought was normal. Now, based on more information, we know it's actually called, puts us at risk of high blood pressure, even though it's not full-blown high blood pressure. So that's why we came up with this category of pre-hypertension, to warn people that they are getting closer to having high blood pressure and they should start changing their diet or exercising more, doing other things to bring themselves back to the normal blood pressure. So as you can see here, normal's pretty easy. Anything on the top below 120, or anything on the bottom, or the diastolic below 80. And then high blood pressure is when we have at least 2 readings. Just one reading doesn't label you as high blood pressure, because it could have been something that happened to you that day, if you got in a car accident or you had a fight with someone. So it has to have at least 2 or more readings of having a consistently high blood pressure. So on the top, anything over 140, or on the bottom, anything over 90. Then anything in between these 2 numbers is what we call that pre-high blood pressure category. So meaning anything on the top between 121 and 139, or anything on the bottom, or diastolic between 81 and 89. And a lot of people ask, well, what if I have a 120, but on the top I have an 89? Which one of these 2 do I fall in? Well, what's been decided for that by that committee of doctors is whatever highest blood pressure you have is the category that you fall into. So even if you said, let's say you had a 80 diastolic, but your top number was 130, even though the top number is the bottom number is normal, the top number is high, so you would automatically be in the pre-high blood pressure category. So now that we know all this, we basically come to the point of how do we know that we have high blood pressure? So, like I said, usually most people get their blood pressure checked when they go see at least their primary care. Some other doctors, like orthopedic doctors, or depending what kind of specialty you see, sometimes they don't necessarily check your blood pressure, but at least your primary care doctor should be checking your blood pressure. A lot of people try to get them checked at home, which is great because that's the best place to check your blood pressure because you're in your more familiar environment. A lot of people have something called white coat hypertension, which means you only have high blood pressure when you see a doctor, whether they're wearing a white coat or not. But you know that you're in a doctor's office, you're probably going to be waiting, you probably have to get some blood draws, you're probably going to get maybe good or bad news, but you don't know what's going to happen. So that brings anybody's blood pressures up. So that's why I always tell people it's better to check your blood pressure at home if you've been told you have high blood pressure, because the most accurate environment to get a good reading would be at home. And not everyone needs to have a brand new blood pressure machine. As long as you make sure your blood pressure machine is accurate by taking it to your doctor's office when you go and having them compare it to theirs, then you would be able to say, okay, well, even though mine's 5 years old, it's still accurate, so I should be okay. But what's not good is, even if you buy a brand new one, going by without knowing if it's inaccurate or not. Because sometimes when they ship things or they try to put them away in the shelf, sometimes things fall or they get kicked, and you really don't know if they have lost their calibration, meaning if their accuracy has been tampered with. So I always tell people it doesn't take a whole lot. I don't know a single doctor that would say, no, we're not going to check your machine, go somewhere else. I'm sure they would. It takes them a second. So if you want to be certain, it's always good to take it with you the next time you go and have them check it for you, because theirs usually are working accurately. So let's say you've been labeled with having high blood pressure. There's a couple things other than medications that you could start doing in your life to be able to bring yourself back down to the normal category, or at least the pre-hypertension category. And the easiest thing, and these are all easier said than done, but a lot of people think, oh, well, everybody knows, you know, it's always good to lose weight. But people get kind of hung up on this losing weight that they don't understand. It's not 500 pounds they have to lose, or 50 or 20, just 10 points, 10 pounds can actually drop your blood pressure by maybe 5 or 10 points, which is a lot. Most medicines don't even drop blood pressure to 5 or 10 points. The very good ones drop them about 10 points. So if you consider just losing 10 pounds, you could drop your blood pressure by about 10 points. It is really kind of a good way to control your blood pressure than trying to be on medication. So I always tell people, just don't get overwhelmed with just the fact of losing weight. Just try for this month, we're gonna try to lose 4 pounds, and the next one will be 4. And in basically 3 months, you've hopefully gone down 12 pounds, which is about 12 points of your blood pressure. So I always tell people it's just easier to take one day at a time. So just look at the short term instead of trying to climb Mount Everest at once, so to speak. So the second point that has been shown to drop blood pressure is not smoking, because cigarette smoke itself contains nicotine, which itself leads people to have much higher blood pressure. And I tell patients of mine that just don't even want to hear about quitting smoking, to at least cut down. Because cutting down, even though you still smoke, is a lot better than smoking whatever amount that you were smoking to begin with. So I've had people that at least cut down to at least 1 cigarette a day if they've been smoking a pack. Little by little, I think it's easier to conquer things than just trying to do everything at once. So I always tell people just to try one of these 4 things that they think they could manage at once, not to do but all at once. For example,